Hey guys, this is Thomas over here at NurseMoneyTalk.com. And so in a previous video I talked about, why nurses should consider learning another language and just kind of like some of the benefits, pros, cons, and whatnot. So I'll link that above, and then I'll also put that in the descriptions below. But in this video, what I actually want to do is I really want to talk about and give you like some languages that I think you might want to consider either learning or maybe even trying to get completely fluent in. But before I get to that though, if you're not already subscribed, I want to go ahead and invite you to hit the subscribe button on this channel. I talk about all things related to nursing student, and of course, nurse life. And also, if you want kind of like a program that will help you learn these languages, check out NurseMoneyTalk.com/Rosetta Stone. You'll see the link on the screen, and of course I'll put it in the descriptions below. I think it's a great platform to really learn languages at, it's not the only platform, and obviously there's a lot of them out there. And I also went over some other platforms as well to consider in the first video that I talked about already, which, like I already said, is in the descriptions below. So let's go ahead and get started. My first pick, which is Latin. Now, you might be wondering, why bring up Latin? Who really speaks Latin and whatnot? And a lot of that would kind of be fair points, but the reason why I bring up Latin is because some people consider Latin as the language of medicine. There's a lot of the terms that's used in medicine, healthcare, nursing, whatever, that really is tied to Latin. So one example would be, if you look at itis, that means inflammation, is derived from the Latin term ides. I don't even know really how to say it. I'll put it on the screen. Another one would be, if you look at circum, so for example, circumcision, trans as in so if you're looking at transcranial, and even supra as in like suprascapula, all of those are Latin, have like Latin terms, Latin languages in them. And so I think it would more so help you in terms of just like learning medicine and the terms of medicine than anything else. It's also one of those things where, like, if you happen to be watching this and you are a student thinking about becoming to a nurse, or even if you're thinking about, going into, being a PA doctor, whatever, I think it would be a great language to learn that would really help you in terms of medical terminology and the class itself, medical terminology. Next one is Spanish. Like, even today, according to Pew Research Center, Spanish is the second most spoken language in the United States. Since 1980, it has grown by 233% in the US, and it's very important. There's in terms of the language itself and being able to speak, it would be very beneficial. It's one of those languages where if you were to go in and try to negotiate a higher pay based on a second language that you speak, especially in the US, I think Spanish in a lot of community hospitals would really kind of help you in terms of negotiating your salary. Next one to consider would be Chinese, and there's a couple of different variants of it. If you're looking at like Mandarin, Cantonese, combined about 16% of the world speaks Chinese. And so as far as kind of like a global language, it would get you pretty far. Something to keep in mind, especially if you are an English speaker, trying to learn Chinese is going to be really, really difficult. It's going to be one of the most difficult languages out there for an English speaker to learn. I think the one that I remember actually being more difficult than that would be, I believe it was Arabic or Farsi or something like that. The next one to consider learning is probably Vietnamese. So there's a pretty big Vietnamese population in the US, about 2 million, over 2 million Vietnamese citizens live in the United States. Next one to consider would be Tagalog. There is a very vibrant Filipino community in the US as well. About 2 million Filipinos live in the United States, and out of all nurses in the United States, interestingly enough, 4% of them are Filipino. And some other ones that I'm gonna throw out there just to kind of consider would be, for instance, Russian. There's almost 1 million Russian speakers in the US, and there are strong Russian communities here in the US. Arabic, there's about 422 million people in the world that speak Arabic. And it's one of those languages where, in all likelihood, you're going to run across somebody who happens to speak Arabic. It's one of the 5 most spoken languages in the world. So definitely a lot of people that speak it. Korean, another strong Korean community, about 2 million Korean citizens or so live in the US, and they make up, just fun fact, about 5.2% of all nurses in the United States. French is a pretty big one, and so some other ones I will just kind of throw in there would be probably looking at Armenian, Japanese, and one that I don't think gets brought up enough would actually be American Sign Language. And so it isn't a spoken language per se, but it is a language, a form of communication that millions of people, rely on in terms of being able to communicate for one reason or another. I know throughout my nursing career, I have actually run across patients who have needed a sign language interpreter to actually be able to communicate as well. And I think part of the thing, when it comes to nursing or even just being healthcare provider, is that, we, in order to provide care for patients, at times we have to do what we can to meet patients where they're at. And even if you look at it, and I touch on it here, I touch on it a couple times here and even in the past video, and even if you look at it from let's just say from a selfish motive, right? I think learning another language could be one more, especially if you learn it fluently, like a language that, is very well spoken. So ignore the first one. So did I mention about Latin? But a language that's very well spoken, that's actively being used by large groups of population. I think it's one more thing you can add to your resume, one more thing that you can add that will make your ability to negotiate that much, put you on a higher ground. Because there are hospitals where, if you look at a hospital that's in, for instance, in a very strong Spanish community, they do need nurses who speak Spanish, and honestly, nurses who understand who understand the culture of the patients who are speaking that particular language. So that's all I got for this particular video. Let me know what your thoughts are. If you think that there's a language that should have been mentioned on this video but that wasn't, or maybe even a patient that spoke a language that you came across that you thought was interesting, that you didn't expect. So definitely mention it in the comment sections below. Thank you so much for watching, and I will catch you very soon in that next one.